In the midst of the still surging pandemic, several glimmers of hope. 2, perhaps 3 vaccines on track for approval following clinical trials showing extremely high effectiveness in combating the disease. The next hurdle, distribution.
There's a lot of work that we need to do very rapidly to make sure that our entire infrastructure is in place to receive these vaccines and do the right education so people can trust these vaccines.
And for the community that seems most vulnerable, trust in some cases could be hard to come by.
Now you see this vaccine, which, all of us would say it takes 5 to 10 years to produce a vaccine, and this has been done in months. Now, I've been following the vaccine, and I think the numbers look great, and I'm hoping that it remains promising. But there's a lot of us keeping a close eye on this vaccine to make sure that it's not only appropriate for African Americans, but just appropriate in general for all of us.
Dr. Samson Davis is an emergency room doctor in Newark and author of Living and Dying in Brick City. He says from what he sees, the efficacy of the vaccines is promising, but getting some African Americans to take it could be an issue.
40,000 people have been given the vaccine by Moderna and Pfizer. So I'm trying to see the numbers. As those numbers grow with more people being exposed to the vaccine, then it does bring a sense of calm. But if you even look at something as simple as the flu shot, which we all should get, by the way, only 40% of African Americans take the flu shot. And the flu shot has saved lives.
According to the Centers for Disease Control, Black Americans are 2.5 times more likely to contract COVID-19, nearly 5 times more likely to be hospitalized with it, and twice as likely to die from it. But still, historical distrust lingers among some African Americans when it comes to the testing of new treatments or vaccines. The historical stench of the Tuskegee experiment, for one. A study begun by the government in 1932 on black men who had syphilis, who were told they were being treated, but who instead were monitored to track the progression of the disease. It was outed by the AP in 1972. The nation's apology in 1997.
Men who were poor and African American, without resources and with few alternatives, they believed they had found hope when they were offered free medical care by the United States Public Health Service. They were betrayed.
More than ancient history, a Pew Research Center study found that African Americans are still more hesitant to trust medical scientists, embrace the use of experimental treatments, and sign up for a potential vaccine to combat the illness. As a result, Dr. Davis says black participation in clinical trials like the COVID-19 vaccine is low, but needs to be higher.
What's broken here is the trust within the system, the disparities and healthcare inequalities and equities. All that has to be fixed. And that all starts with just sort of addressing the sort of elephant in the room, which has been historical factors that have taken place throughout our time.
Now, the oldest and largest black doctors organization, the National Medical Association, plans to do its own vetting of the leading vaccines to increase trust in communities of color. Its president, NMA Task Force, says that, he says that they plan to review available data to make sure evidence exists of efficacy and that diversity is represented in further clinical trials.